This is NainaMD, Beverly Hills, Fusion of Science and Beauty. Welcome to my show. As you know, my passion about anti-aging and integrative medicine is so immense, and especially for 2017, we're going to have so much knowledge. Every day is a learning experience, both for me and for you, because I can't even keep up with so much things that are happening in terms of beauty, in terms of our health. We are really in a revolution, a health and beauty revolution is going on right now. And I have a fabulous guest. As you know, transgender is big. It's big, it's going to be big, even bigger, especially with new laws changing, especially younger and younger people are opting to become transgender at a much younger age. When this transition happens, there are so many things that need to occur. And some of these are critical in sort of putting that finishing touch. And one of my guests, especially today, her name is Elise, and she is phenomenal. She is not only phenomenal in sculpting the hairlines, in doing the eyebrow shaping. The most important part is the treatment of the genitalia in making that appearance as it should be. And no better is Elise today as my guest of Elise Solutions. Welcome to the show.
Hi, Naina. So nice to see you.
So,
it's a pleasure
you've been over 30 years, for goodness, a master electrolysis.
Thanks.
This is so needed in the treatment of the genitalia, especially in transgenders.
And also the beard. I mean, you know, that's a giveaway. And
yes.
So the most important part is taking care of prior to surgery. It has to be completely clear, and it's true permanent hair removal electrolysis.
Yes.
Where laser is wonderful for the other areas of the body, if somebody has dark hair and light
yes.
skin, but if they don't,
it is not a permanent hair reduction.
No, right,
and
laser is not. It's wonderful, but electrolysis is what you need, or what the transgendered yes. community, we've been working with them for 38 years. So I've seen a big change.
You've seen a sort of almost a transgender, it's almost like a revolution.
Yeah.
In terms of really what was there.
Interest and acceptance.
Yes.
And watching these wonderful people live their true life of who they really want to be. This isn't a game. This is somebody really going, this is how I feel. This is what I want to be.
Not only that, but I think in terms of the looks, as the aesthetic, and for them, for the transgenders to feel that when they look in the mirror that this is me. The reason I really wanted you to come on the show is to educate the audience, is that there are certain touches that are just so needed to sort of give that finished look. And I drew attention initially to the genitalia treatment is because we have to be absolutely, that the hair has absolutely got to be clear.
Clear, yes, because
you cannot
basically everything is being inverted,
yes.
and a beautiful vagina is being born.
Yes.
So they're having a rebirth, if you will. They're going on
Yeah.
this amazing journey that takes a lot of time, effort, pain, consciousness. It's a huge. Imagine changing into
so
who
that
you
becomes
believe.
so that hair removal
has to be precise.
Precise.
So it's like microsurgery.
It's like I've seen you. It's you're there hours, literally up to 6 to 8 hours, and each follicle has to be done
treated,
just right.
It
has to be treated, and it's in a way a microsurgery, because you cannot over treat, you cannot under treat. It's just got to be just the right way to address that hair follicle. So that in itself is a huge I think you need somebody very skilled.
Yes.
You need someone very skilled to do that.
Well,
Second thing is a beard.
Yes.
You know, the beard, the creating of the definition. How do you judge? How do you, when you look at someone, how do you figure that out? Or are there telltale signs? I mean, how does that work?
For the transgender community, usually we're double teaming, and Karen, my partner, and we have 4 electrologists now, because it's.
Where do you start? But do you start from the outside, or then start to remove all the hair from the out?
Remove it from the upper cheeks all the way down to the lower neck.
Got it.
And we usually double team, so Karen will work on one side, or Gladys, one of my electrologists, and I'm on the other.
How long could that take?
It usually takes about a year and a half for completion, up
And
to
each
2
sitting,
years.
each sitting?
Each sitting can be anywhere from 6 to 8 hours, and for an entire
Amazing.
very thick beard, you're usually looking at 2 electrologists working 2 days from 10 to 6.
Amazing, amazing.
And what's really wonderful is we have this wonderful cream that we have them use afterwards, where it used to take 7 to 10 days to heal. They're now healing in 3 to 5. It's called Sickle Fate. It's wonderful. And we work with Dr. Meltzer, we work with Dr. Bowers, we work with all of these wonderful surgeons who do the actual work. Meltzer and wonderful endocrinologists. So it's a whole journey. We work with hairdressers and makeup artists and speech therapists. So it's a whole package.
Yeah.
And
Tell me about the eyebrows.
well, the eyebrows in the meantime, while they're going through transition, sometimes they still have to go to work in their male state. So we don't want to make them have eyebrows like mine.
Exactly.
And so as we graduate and they're telling everybody at work, I'm now in transition and I'm going to be coming to work dressing as a woman, and you're going to be calling me Emily, not Tom. And then there's this wonderful acceptance, and then we do their eyebrows and they're wearing feminine clothes, and they are living as a woman, as their true self.
Do you give shape? Do you help
Sure.
give shape to the
Of
brows,
course.
right?
Well,
Yeah.
I sculpt eyebrows and hairlines
That's really
for
cool.
celebrities and women, and
That's
do
really cool.
after plastic surgery for men who've had facelifts. We reinvent the hairline. So this is just a natural extension of helping male to female transition for the transgendered community.
That's really cool. And I think it's important also for people to understand what is the how do your clients when they're there for about 6 to 8 hours, right? How do they experience pain? Because a lot of the first question I know people are going to want to know is like, is it age? Every hair follicle has got to be right, so to speak. Electrical current is given into every hair follicle. Is it very painful? What do you do to dull the pain, so to speak? Or, how do they leave the procedure? Are they in pain? Do they require pain medication? All these questions come up.
Sure. A lot of people will use a topical anesthetic, a very strong one. We work with people who come from insurance, because insurance is now covering it for both beard and genitalia. And then we work with a doctor who comes in and does the lidocaine injections. And some of the patients will go to their doctor, get injected. It's just a block away.
Right.
And then they come to us, and we can work usually 4 to 5 hours for the genitalia. And that's plenty of time for a clearing. Then they're coming once a month, because regrowth takes 3 to 5 weeks.
Yes.
So it's clearing, eliminating, thinner until you have nothing. And usually for the genitalia, you're looking at a year. You should leave a year's time to be prepared for surgery. It's crazy when people are like, oh, I have my surgery in 3 months. I'm like, no, you don't. You need to reschedule, because you can't have hair inside. It can cause infection. It can cause ingrown hairs. And hopefully you're utilizing it for your new womanhood. Yeah. And you need to be mindful that every hair needs to be gone permanently.
So this is pretty remarkable. After they leave, there's no
pain. No, it's just while you're doing it, it's not fun. If you just have numbing cream, a lot of people will have great tolerance and can do 3 to 5 hours on the face, and some people maybe 2 hours in the genital area, but it's really a lot nicer to have it be
Do you
numb.
do multiple areas in one treatment, or do you just stick to just clearing one area at a time?
We have several clients where Karen or Gladys will work on the beard, and I'll work on the genitalia.
Got it.
And as long as they're numb with the lidocaine, they're watching TV, or we're talking and solving the world's problems as, it's a therapy session as well. I mean, they become family. It's a very close, intimate setting where, you're exposing yourself to us, and
plus, for that length of time. Plus, it's just not an hour treatment that you're coming an hour once. It's multiple hours. I mean, a long time. What is needed generally as part of the team? You said endocrinologist. You have the surgeon. You've got the electrolysis, and then of course the hormones, right? They need to be balanced. What have you noted? Do you see an emotional change in the transgenders over the year that you treat? I've always wanted, I think the audience would love to hear something about what changes have you generally seen that occur from, let's say, when you
From the beginning.
From the beginning
Yeah.
to the end?
It's amazing. I'll give you some of the before and afters. I've seen actual face changes from a big beard and a rounded face to a more developed and oval face, softened. As far as emotions, they cry at every commercial because as the hormones set in, the male hormones are being depressed. Yes. And the female hormones are taking over. They're growing breasts. So initially they grow breasts that are like teenage breasts, and then they're given estrogen where it's more rounded and becomes more of a woman's breast. And many times they don't have to do any breast augmentation, which is wonderful. I try to tell them the less surgery as far as facial feminization, because a lot of them are very beautiful as is. I'm like, don't start putting everything in that you don't need. Let's see what the hormones do as far as reshaping and softening. It softens the hair, but it does not kill the hair. One of our patients was actually an Army Ranger, and so came from being machismo, thinking that I have to be the strongest person because fighting this change, and then realized I want to make this change, and said that now once having these hormones, noticed that many things set them off to be very teary-eyed, you know, very emotional, much softer. And it's really pretty wonderful. And I'm like, well, welcome to the woman's world.
That's really cool. That's
of being so much more sensitive to things.
It's amazing how hormones make such a difference, doesn't it?
It changes your world. Well, look how they change our world. You know, look at women through menopause. And women just starting their period and all of the changes in young adulthood. So hormones.
Well, that's a very core, in anti-aging, you know, hormones are bioidentical hormones. We don't do in generally we emphasize the bioidentical hormones, the same structure as your own body.
Correct.
And generally we use topicals rather than the injectables or you know, oral. But there's when we balance the hormones, so much of the emotions, so much of the a lot of the, so to speak, the things that we had in our youth, you know, when you replenish, you still can regain some of the things that you had when you were younger.
Yes, and I think the true essence of the person can come through, you know, especially when they're transgendering and they're transitioning into this new person that they want to live as their true life. It's their true self.
Because those levels of hormones they're getting are when generally a female would get when she is younger. So they're actually very, very fortunate to experience at any age that they choose to do this, the experience the hormone levels when you know, females had when they were young.
Well, one thing that's interesting, I have a 20-year-old that we're working on, and she's just wonderful, up to a 60-year-old. Most are 35 to 40. Incredible lawyers and vets and business people that are just exquisite. And then we have to really note to the world that there are a lot of teens going through this. The highest suicide rate of all people who are into suicide because of not having support groups. We have a huge support group for our clients. We make them family, and it's a really important thing to welcome people, all doctors, to be kind, and as they receive these people, whether it's dermatological or plastic surgery.
No, this is so important. You're doing amazing work. Please give us your website. With the audience would love to, I'm sure, have that information.
Alrighty, it's NainaMD.com.
Okay.
And we work with Dr. NainaMD.com very closely. You're fabulous, and we so appreciate the work you've helped us with. And please call us.
And what's the telephone number?
It is 310-550-5566, or you can reach me at Dana@DanaElise.com.
So you heard that, everyone. This is a great electrolysis. Being an electrolysis and undergoing electrolysis procedure is the only way to have permanent hair removal. I urge you to at least look into this. Even if you're not a transgender, this is an amazing way to undergo a procedure and just have your hair taken care of once and for all. So thank you for being on my show.
Thank you for having me.
This is not the first. We're having another topic to cover.
Yes.
We'll tell you that.
I'll be back.
Yes, she'll be back.